Uganda's rapid urbanization and economic growth are driving progress, but they're also contributing to a growing environmental challenge: pollution. Across cities and rural communities, pollution from vehicle emissions, industrial activities, and poor waste management is affecting the air we breathe, the water we drink, and the safety of our food systems.
It's very difficult to find a place in any of our cities, be it Kampala, be it Jinja, be it Fort Portal, Gulu. It's very difficult to find a place that has very acceptable clean air levels in line with the World Health Organizations. So it shows that we need to take action.
We have issues of indoor pollution where we have rural communities where they still cook indoors using biomass, or where in some cases we have communities where animals reside near homesteads or inside home dwellings. We have emissions from constructions. We have issues of water pollution where we have discharge of partially treated effluents or discharge of improperly treated sewage from pit latrines or from sewage treatment facilities.
We realize that these communities are being affected by heavy metal pollution from the activities they do, like metal smelting and fabrication, activities like the use of lead paint within the communities, and even some of the daily activities that happen in our houses, like water coming from the pipes. These pipes do contain a lead, and it's affecting the people's health.
To confront this challenge, the Global Alliance on Health and Pollution, in partnership with the National Environmental Management Authority, Uganda, and partners, developed the Health and Pollution Act plan.
This action plan, the issues we have identified, the actions, once they are implemented, we should be able to add something to addressing some of these issues. In NEMA, we have definitely done a lot as our mandate. We have a number of regulations in waste management regulation. We have air pollution regulation in 2024. But the issue is enforcing these regulations. That has been the issue. And therefore, I want to think that with this action plan, with the strategies we have put in place, this project, this action plan will support the enforcement of these regulations.
No single ministry, not even NEMA, which is an agency of the Ministry of Water and Environment, can tackle this challenge of pollution alone. So to my comrades from the government MDAs, we do need pollution and health metrics to be integrated into the physical planning, industrial licensing, and agricultural policies of the country. The regulations need to be clear, enforceable, and aligned with health outcomes.
KCCA is responsible for waste management as an institution, but the Act specifically indicates that waste belongs to you as a generator until the collector comes. As KCCA, we do collect waste. We take all necessary measures and reasonable practicable measures to maintain cleanness of the city.
This comprehensive framework identifies major pollution sources, including domestic and municipal waste, medical and industrial discharge, mining activities, and the widespread use of agrochemicals.
The Ugandan government has taken steps over the past 5 years to address Uganda's growing pollution challenges, including, among other things, the passing of the National Environment Act and the introduction of the National Environment Air Quality Standards Regulations. We also know that NEMA has been proactive in leading cross-government initiatives in this space. This framework gives us confidence that we will be able to work effectively with you on pollution control that yields the greatest benefits to health and the environment.
These pollutants contribute to serious health risks such as respiratory illness, waterborne diseases, and long-term environmental damage.
In Kampala, the waste is mixed. The waste is mixed. We have what we call kavera commonly, what we call the bottles, the single-use bottles after we drink water, and those are plastics. Now plastics, when plastics are burnt, they release a very toxic air, they release a very toxic smoke, and that smoke is very, very dangerous to our health, especially if we continue inhaling it. And this is attributed to some of the effects, ailments that we have, like respiratory effects.
There is low awareness in communities, so communities are not aware about the risks, the health risks and the economic impact of pollution. Yet we have seen that pollution is driving most death in Uganda. We have realized that people in Kampala are burning waste.
But the challenge is in the management of pollution. How do we manage this pollution? How do we treat this waste? Because if this pollution is generated in terms of solid waste and also in terms of liquid waste, and it's managed properly, it would not be a problem. But I think the problem that we are seeing in the city and in part of our industries is that we generate pollution, and that pollution is not managed properly. The solid waste is not disposed in a right way, and also the liquid waste is not treated to the level that meets the standards before it is discharged into the environment.
Pollutants not only severely impact health, but also the Earth's climate and ecosystems globally.
The pollutants generally, some go across the board. The VOCs, CO2s, NO2, SOx, NOx, and heavy metals and particulate matter. I want to close with a call to action. We must strengthen coordinated action because we all have a role in reducing air pollution to safeguard the air we breathe.
The plan focuses on key priority areas including air pollution, water contamination, agrochemical pollution, and solid waste management, targeting the most vulnerable populations, including children, women, farmers, and low-income urban communities.
For Uganda, for the Health and Pollution Action Plan, we developed a preliminary assessment report that will be presented shortly. But we started this with a number of priorities, including waste management, air pollution, water pollution, contaminated sites, heavy metal pollution.
So our theory of change encompasses three things mostly. One is to support and to build political willingness, because of course if there is not endorsement and collaboration from the government, things won't be sustainable and can change. The other is, as I mentioned, is to produce really the science and the evidences on why we do this and why we do it this way.
Through a collaborative technical working group, experts from government, civil society, research institutions, and the private sector have worked together to develop practical, evidence-based solutions.
Once this document is signed, because the next step is, yes, revise all the comments, conclude a strong draft, which will no longer be a draft, it will be a final document, and then this to be signed by NEMA. If NEMA signs the document, which means they validate it with a signature, then we consider this is official.
Let's approach the Ministry of Finance, let's approach development partners so that they're able to give us resources. It is worth resources. We may not start big, but let's touch whatever resources we can get so that we are able to start moving. Let's not stop.
Innovations such as low-cost air quality monitoring systems are being introduced to better track pollution sources and guide effective interventions. Supported by the Department of Environment, Food and Rural Affairs through UK International Development, the initiative provides a clear roadmap for coordinated action, resource mobilization, and accountability. By tackling pollution today, Uganda is safeguarding public health, protecting its environment, and building a cleaner, healthier future for generations to come.